Hello, class. I'd like to thank you for viewing my presentation, and the topic I chose is liver cancer. And the objectives of this slideshow is after the presentation, the audience will be able to identify the two most common liver cancers in primary liver cancers in adults. This slideshow is not going to address metastatic liver cancer. The audience will be able to identify the most prevalent pediatric liver cancer. The audience will be able to briefly describe the etiology and epidemiology for each, and will identify risk factors and treatment strategies for each. Okay, so there are two primary liver cancers, that are seen in adults primarily. One is hepatocellular carcinoma, HCC. That arises in the liver cells. It actually arises in the parenchyma, the essential cells, hepatocells of the liver. 80% of liver cancers are hepatocellular carcinomas. And then the second is cholangiocarcinomas. These are cancerous tumors that form in the bile ducts. This is the second most common form of liver cancer. It accounts for approximately 15% of all liver cancers. I don't know if you guys remember Walter Payton. He was a big hero running back for the Chicago Bears in the 1985 season. He died from liver disease, and he died from a disease that leads to liver cancer. Then in pediatrics, there's hepatoblastomas. That's the most prevalent pediatric liver cancer that is seen in young teens and children under 3. It's primarily seen in kids under 3. 70 to 90% of hepatoblastomas are treated successfully if they are found on time. So we're going to address the etiology and epidemiology of hepatocellular carcinomas. There's no exact cause. The literature that I uncovered claims there's no exact cause, but multiple risk factors linking these factors to the development of HCC have been identified. One is greater than 60 years old, males, more so than females. Ethnicity, it typically affects African Americans at twice the rate as Caucasians, and Asians are affected at 4 times the rate of Caucasians. So again, with risk factors for HCC, I'm going to continue on that. There is cirrhosis. Somebody diagnosed with cirrhosis is 40 times likelier to develop HCC than somebody without liver disease. Then there's hemochromatosis. This is a condition of abnormally high iron levels in the body, which also can result in cirrhosis. So now remember that cirrhosis is linked to liver cancer. Hemochromatosis, a condition of abnormally high iron in the body, is linked to cirrhosis. Exposure to Hep C and Hep B viruses. Globally, as much as 80% of the hepatocellular carcinomas have been linked to the hepatitis B virus. Hep C is the most common cause of cirrhosis in the world. The risk of developing liver cancer after contracting Hep C is 7 times greater than those without a Hep C infection. That's pretty significant. And there's a wide geographic variance in the incidence of liver cancers. Most cases are reported in underdeveloped countries. China, a developing country, but much of it still is undeveloped or in the state of development. China accounts for 50% of the newly diagnosed cases of hepatocellular carcinomas in the world. Liver cancer is the 3rd most fatal cancer in the world. And remember, a few cycles ago, we learned about aflatoxins. Now, this is interesting. Aflatoxins they're a naturally occurring toxic foodborne substance found in nature. They're a metabolic product of fungi, namely Aspergillus flavus and Aspergillus parasiticus. They're found on the surface. This metabolite from fungi are found on the surface of peanuts, various nuts, walnuts, pistachios, figs, corns, grains, cornmeals. This can cause, has been known to cause hepatitis B, and is potentially a carcinogenic agent. Now I'm going to address cholangiocarcinoma. That's the second most common liver cancer. It accounts for 15% of all cases of liver cancer. Primary sclerosing cholangitis is recognized as one of the most established risks of getting a cholangiocarcinoma, rather. That's where I wanted to return to Walter Payton. Walter Payton was one of the best running backs in NFL history, and he was part of that incredible Bears team. I don't know if you guys remember him. They used to call him Sweetness. He was great. But in 1985, he was one of the greatest athletes in the world, and I think by 1997 he passed away. And he wasn't a drinker. However, the connection with alcohol abuse is still debated by clinicians and scientists, and the jury is still out on that. But primary sclerosing cholangitis accounts for almost 1/3 of all the cases of cholangiocarcinomas. Hep B is more frequently associated with this condition, with this cancer, than Hep C. And then, of course, I wanted to mention thorotrast, and this is interesting. This was a radioactive dye that they used with thorium in the 1930s and 40s and up until around World War II. And they used this as a contrast medium to enhance radiographic imaging. And they used it so frequently because they felt the side effect profile was almost nil. And then people started to develop liver cancer, primarily cholangiocarcinomas. So that's no longer used. Thorotrast was the name of the dye, which is made of thorium. Now I want to address hepatoblastomas. This is the most prevalent pediatric liver cancer. The incidence is 1 to 100,000. It affects boys more than girls at a ratio of 3 to 1. Typically occurs in children younger than 3. However, it has been seen in young teens, and it is possibly associated with low birth weights. And who would be associated with low birth weights is people that are born preterm, children that are born premature. So the treatment for adult primary liver cancers, one is surgery, resection or transplantation. However, this is seldom effective. Most often METs are already present at the time of diagnosis. There's a high incidence of recurrence of the cancer after the transplant. Then there are ablation therapies. There's ethanol ablation, which is simply under the guidance of ultrasound imaging. Alcohol is directly injected into the tumor to lyse cancer cells, and this is considered palliative. Then there's radiofrequency ablation, where a CT-guided placement of a wire is inserted into the tumor. The wire emits a certain radio frequency in order to shrink the tumor. Again, this is considered palliative. Radiation treatment, that is seldom effective. Liver cancer is typically non-responsive to radiation therapy, or it has been used as a palliative measure. And chemotherapy, methotrexate and fluoxuridine have been used as palliative treatments, and genetic therapy has been being investigated utilizing retroviruses. That's something we learned in a few cycles ago. I found that very interesting. Overall, the prognosis for primary adult liver cancers is very poor. There's a poor prognosis for both hepatocellular and both carcinomas and cholangiomas or cholangiocarcinomas. there is a less than 10% survival rate 3 years after the diagnosis, and that is with or without treatment. Greater than 50% of the patients that are diagnosed with liver cancer die within 6 months of the diagnosis, and there is less than a 4% survival rate 5 years after the diagnosis. So those are some, unfortunately, grim figures. Liver cancer, there are preventive measures that we can take, and one of the main things is vaccination against hepatitis B virus, and address alcohol abuse. Alcohol abuse has been linked for years with cirrhosis of the liver. As I mentioned, when I said no known cause, there are several risk factors that are strongly linked and strongly identified with the development of liver cancer, but the whole entire sequela of events and the exact mechanism is still under debate in some circles. But it's well worth addressing any alcohol abuse. Lifestyle, IV drug use is strongly associated with hepatitis C for years. Avoid exposure to hepatitis B and hepatitis C. Early initiation of therapy. If diagnosed with hep C, there's a number of new therapies out for the treatment of hep C antiviral treatments. Avoid foods potentially fostering molds that produce aflatoxin. I've mentioned that before. That might be one of the harder ones to do. However, that's seen in some countries that there are poor processing methods and less stringent inspection. But that's still that fungi can exist anywhere. Those fungi can exist anywhere. So I'd like to thank you for your time in giving me the opportunity to present this. Again, a few basic things I wanted to go over in summary. There were two types of major primary liver cancers. Metastatic liver cancer is a separate topic, although again there's poor prognosis with metastatic liver cancer. And in many instances, what I've read, the cancer itself might not be what leads to the death, but it's the development of liver failure and the sequela of liver failure, ascites and all the unfortunate things that go with hepatic failure that attribute greatly to the mortality rate of hepatocellular carcinoma and cholangiocarcinomas. And again, we've identified the risk factors. There's some prevention strategies. However, all of the treatments, if you can see the one thing that they had in common, they were all palliative. They're used to prolong life a little bit, maybe so somebody could have another holiday with the family, so somebody could be in a little less pain, so somebody could go to one more place, see one more museum, tell somebody that they love them one more time, see a grandson one more time. Indeed, they are palliative. The numbers are grim. Hopefully they'll improve. I'd like to thank you all again for watching my video, and I look forward to hearing from you. Thank you.